Hi everybody, Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today's topic is the importance of understanding insurance. And you might say, Jen, duh, we work in the medical field, of course we need to understand insurance. But honestly, in my experience, there are some gaps in understanding insurance across the staff in an office, and this is mostly going to focus about not just you as the provider or owner understanding insurances, but your staff and their roles and why it's important. Let's start with the front desk. You need to have at least one person at the front desk who is very well versed in insurances in your area, understanding their roles and tasks at the front office, and being able to teach and pass that knowledge on to other people that you hire that might not have the same experience or knowledge base when it comes to this. But one person at the front desk is very important. At the minimum, I would encourage you to have 2 or 3, because if your manager has a strong understanding, which they should, and they're not available all the time, you need someone who is there working live that can help everybody when they have questions with insurances. If you use a billing team, you might not be able to get a hold of them in time. So people in the office itself really need to have a good, strong understanding about insurances and what they require, why they require it, how to bill to them, all of those things. Of course, not every role needs to understand all of that, but the front desk is going to need to have a very strong, healthy understanding about all of that. And then, of course, your billers, and then your back office staff with your medical assistants, nurses, other providers need to understand insurances as well, because it affects prescriptions, imaging, services offered during their visits, all of that. Now, the first thing that they need to know, and even you, is what insurances are offered in the area and which ones your specific office is contracted with to be as considered in network. That means when patients come to see you, they get the biggest bang for their buck essentially through their insurance company, and it's going to be covered the best. That's number one. Number two, your staff needs to understand what a deductible is, what a coinsurance is, and what a copay is, because they're all different and they all affect different things that you will be doing in your office. Hopefully you have someone in management or billing that is guiding the front office and making sure that they are having correct conversations and communication with patients regarding this, and you have policies and procedures set up for this. But that doesn't mean that you shouldn't have all your staff understand this, because in a small practice, everybody will have to be cross-trained and they will have to wear many hats. And if a back office person is going to have to cover the front desk for some reason, they need to know it so when they cover, they understand it and don't feel like a fish out of water. It also will help them in their personal lives, because if anybody has insurance, they're going to have most likely a deductible, a coinsurance, and a copay. It's just the way it is. The other thing that you need to have them understand is what formulary medications are and what non-formulary medications are. Because when it comes to prescribing medications in the back office, a lot of EHR systems will actually check a patient's insurance for you through the system to see if a medication is going to be covered by their insurance or not. A formulary medication most of the time is covered, and there's different tiers of coverage, so that means there's different prices related to these tiers. And then the non-formulary most likely is going to require a prior authorization. It's nice to know this up front, because then you can be proactive and you could submit for the prior authorization. The providers need to understand what this is, and the medical assistants and or nurses, because most likely in your workflows, I'm going to assume they're going to be the ones responsible for submitting those prior authorizations. They're also going to be the ones getting the phone calls from the patients if they go to the pharmacy and their prescription's not ready because it's not covered, or it's super expensive. Maybe it's a formulary medication that's tier 3 or tier 4 and it's out of their price range and they can't afford it. Those are the things they need to understand. So when they're having communication with patients or the pharmacies, or they're helping the other providers, they are knowledgeable and helpful. The next thing they need to know is which payers or insurances in your office are going to require a referral or prior authorization for certain services. So they need to know if there's certain plans within an insurance, like around here, Providence is a large payer, and they have certain plans that require a referral from a primary care in order for them to be able to be seen at a specialist's office or outside of their normal network of doctors. So that means that the primary care needs to initiate a referral request through the insurance, and they can't be seen elsewhere and have it covered until it's approved by the insurance company. If you know this ahead of time, then when those patients try to schedule with those certain plans, you can say, well, we need a referral, or just to give you a heads up, we're probably going to need some prior authorizations. So we can work on that for you and call you back when we receive that so that we can see you. Otherwise, you would have to pay out of pocket to be seen. That way you're not losing money in your business. The patients are understanding their coverage and benefits, which sometimes they're not very happy about once you explain it because they don't know before that. And it also helps making sure that you're going to get paid for those visits and the patient isn't going to be responsible for a ton out of pocket. Now, a lot of insurances say you can't bill patients if you see them and they required a prior authorization or a referral, because it was your responsibility to do your due diligence to understand that, and you cannot just turn around and bill the patient for your error, essentially. So that's why that is important. Also, with diagnostic imaging, usually if you need anything above an ultrasound or an x-ray, you're going to need a prior authorization. So if your providers are going to be ordering these kinds of advanced imaging, CT scans, MRIs, sometimes PET scans, depending on your specialty, you're going to have to get a prior authorization first before the patient can have that service. So it's good for your back office people to also know that, because they're going to be the ones, I'm assuming, going to be obtaining those prior authorizations, and they're going to have to understand all of the ins and outs when it comes to what the insurance is asking to get those prior auths. That includes what a CPT code is, what an ICD-10 code is. It's just, if you work in the medical field, you should have a very strong basic knowledge of insurance, and this is all included in that. Especially once you work in a specific area, because you'll start learning the ins and outs and nuances of all of your local insurances, especially the ones that you accept in your office and that a lot of your patients will have. United Healthcare is a very common national payer. Blue Cross Blue Shield is a large one. Aetna, Cigna, HealthNet. And then you're going to have your local Medicaid for your state, and then the Medicare. They also need to understand the insurances and their requirements, because you don't want them to inadvertently cause any kind of issues or concerns when it comes to billing. You don't want to be accused of any kind of billing fraud, waste, or abuse. That's why it's really nice for you to do that fraud, waste, and abuse training that CMS requires before they start seeing patients and before they start working, and then they can apply that and kind of see how that works. It's also good for them to understand the billing part of the insurance just a little bit, because most likely your back office is going to have to make sure that they're billing for the UA dips and the vaccines that they're giving, or therapeutic injections, or any kind of point of care testing. They're going to have to make sure not only are the results recorded that they did it, but that it's being billed for appropriately. So understanding why the CPT code and if it needs units attached. I encourage you to make sure that when you make a new hire, that they have a full day to review the insurance information and knowledge that they're going to need for their role specifically. So back office might not be as extensive or specific, but the front office will be. That way you know that you're training everybody the same way and they're starting on the right foot, and you're giving them as many tools and resources as possible so that they can be successful in their job and inadvertently doing well for you and your business. Insurances can be tough and they can be confusing, so it's good to have at least one, if not more, people in the office who has a strong understanding that these people can go to and ask questions when they need to. But at the same time, they need to have their own knowledge base to work from so that they can do their jobs efficiently and do well by the patients. I'm sure I'm missing some important things to teach your staff about, but make sure you and your managers are doing the right thing by when you hire people, you understand what their existing knowledge base is when it comes to insurance, if they have anything, and that you're building from that, you're helping them, and that you're training everybody the same way every time you bring them on, no matter their position, so that you know where they're starting from and they can't use the excuse that they didn't know. You also want to make sure that you're telling them who to go to if they don't have the answers, and that someone can answer quickly for them to get things done. If you have any suggestions or I missed something, please leave that in the comments below. If you liked this video, smash the thumbs up button and subscribe to my channel if you haven't already. I really appreciate the support, and I do see I'm growing more and more followers every day, and it makes me really happy. Stay healthy and take care of yourself. Bye-bye.